I can see that it's not normal. It's swollen, it's warm. I can see it's a big problem. Ouchie, ouchie, that's very sore. Hi. This is what we call an oral hematoma. We do see it a lot around this time of year.
Yeah.
And that's basically trauma to the ear. They're shaking it, they're scratching it, they're rubbing it, and all those vessels inside her ear burst, they bleed out, and it forms a blood blister.
Right.
And that blood blister sits between her skin and her ear cartilage, fills up, and what happens if we leave it is that it can actually destroy that cartilage in the ear, and it will form like a cauliflower ear.
Okay.
So we do need to get in, we need to drain it, because if that ear crumples down, we're going to block her ear canal, and that's a lifetime of ear issues for her. So unfortunately it does mean surgery, because you have to drain that blood bubble, get that pressure out, and then we've got to close down that dead space. So really compress that skin back onto the cartilage so it doesn't refill with blood. So it's really easy to drain, but really hard to stop it refilling. So we actually use a technique where we suture the cartilage to the skin, and we use buttons, like your actual shirt buttons of different sizes. And what that does is it spreads the pressure, so it squeezes that dead space tight so it doesn't refill, and we're not doing the surgery again.
Right, okay.
Yeah.
All right.
So it's going to be an interesting surgery, and she's going to look very fancy when she gets home.
All right, okay.
We'll pick buttons that suit her. You ready for that, Missy?
So Missy will be fine. It'll be Scout that will be missing her.
Oh, she's going to be a brave girl. All right, Missy, let's go. All right, you going to say bye to Mum? Good girl. Okay, let's go. All righty.
In Sydney, Audrey's arriving at the vet hospital with 2-year-old Great Dane Missy.
Hi, Emma. This is Missy.
Hello.
We've got a sore ear.
Oh, that's big.
I know, it's a huge blood bubble. We reckon it's come from flies, because this time of year there's flies all around her head and she just keeps shaking and flapping it, so probably burst some blood vessels in there. In this environment, Missy is a lot more calm. She's easy to handle, she's actually relaxing and lying on the floor, so I can have a very good look at her ear. That just looks, so big now that she's sitting still.
Oh, that does look sore, doesn't it?
It's really sore, isn't it, Missy girl? And it's getting bigger and firmer. Because Missy's blood bubble is getting really firm, it could now be turning into a clot and affecting the cartilage. If we don't do anything to this ear, it will damage the cartilage in the ear, and that ear will form a cauliflower or big ball of scar tissue, blocking any air into the ear canal. So we really need to get into surgery today, drain that, and then obviously we've got to close down that dead space. So I'm gonna need some funky buttons so she looks beautiful post-op. Buttons make the perfect size and pressure point for us to seal that dead space. Have you got any for me?
Missy, do I have a thing for you?
Oh, she delivered. In anticipation for today, Emma has brought along some fancy buttons for the operation. We've got some purple, we've got some blue, we've got some marbled grey. Why don't we let Missy do the picking, hey? What do you think about these buttons? Whoa.
What do you think, Missy?
Which one? Do you like this one, or this one? Because I don't care. What if we do a mixture of all three?
Sounds good to me.
Right? Get you feeling better and looking pretty. I think there might be a height disparity.
Audrey plans to make an incision underneath the bubble and drain it, before stitching down the buttons to compress the space and ensure it doesn't refill with blood.
Okay. All right, Missy, I know you're feeling really woozy. We're just gonna pop a cannula in. Good girl. Oh, she's a brave girl. You're a good girl. You're a good girl. We jewelry. All right, Emma, I'm gonna inject now. Sweet dreams. So now Missy's asleep, we can have a really good feel of this blood bubble. And I'm a bit concerned because it's starting to feel firm, which means that that blood could be turning into a clot and that cartilage underneath could be damaged. If Missy's cartilage is damaged, what that means is that the ear is going to change shape and she's in for lifelong issues. It's going to crumple down, block the ear canal, and she's going to get infection after infection after infection. So, moment of truth, Emma. I'm going to make an incision and we're going to see if blood pours out or little jelly bean clots.
In Sydney, Audrey's about to drain a giant blood bubble that's formed inside 2-year-old Great Dane Missy's ear.
The danger of a blood bubble like this is the damage that it could do on the cartilage. All right, so I'm going to make my incision now. I'm worried when I open up Missy's ear that I'm going to see a really crumpled or deformed cartilage. If there's any scarring or there's any crumpling of the cartilage, that ear will be deformed for the rest of her life. So I'm just squeezing it out and there's so much blood coming through. You can just imagine how painful this would have been in her ear. Oh, it's a lot. You can just imagine that pressure in there. So I'm just pouring it out. It is just starting to clot, but not quite. All right, so I'm just gonna have a feel of that cartilage and I've drained all the blood out of the incision and now comes the moment of truth. I'm gonna have a look and a feel of that cartilage. And that cartilage actually feels okay. A little bit wrinkly, but okay. Feels pretty good. It's a little bit rough, but it's overall flat. It's not starting to scar. I'm having a look and a feel of the cartilage and it looks great. It's nice and smooth, there's no scarring. And so that means this ear is going to heal beautifully. She's going to have a normal ear once she's fully recovered. There's just starting to clot there. You can see there's one little clot starting.
It's good timing.
Very good timing. I think just in the nick of time, to be honest. All right, let's give it a flush.
She's going to feel so much better with all that pressure in there.
Yeah, ear pain's the worst pain, isn't it? All right, Emma, it's button time. Pick a colour, any colour. Let's get this one. Cute choice. Now it's time for the fun bit. We're going to flip the ear around and decide how to place my buttons. But there is actually a surgical reason why we do that. And that's basically to apply pressure between the cartilage and the skin so it sticks together to prevent that blood building up. How about another pretty purple one there, just to make it even. If we don't, keep that dead space compressed. Blood will refill and then we've got to do the whole surgery again. All right, Missy, we're on your lucky last button. It's a bit of a purple theme and I think you're gonna love your new button earrings.
Which is going to be a studded style.
Very fancy. That is so pretty. While the outside looks nice and pretty with the buttons, the inside is a bit of a different story. We've left a large incision or slit so that any blood that accumulates can actually drain out of the ear. All right, let's take this drape off. Oh, that's the inside of the ear. And that's the outside of the ear. That is so pretty, look at that. Matches her skin. All right, we're ready to wake up. That is ready to pull. That is so pretty, look at that.
3 hours later,
Good morning, sunshine. How are you feeling?
Missy's awake and ready to go home, with a few accessories to match her new earrings.
Emma's got you a little surprise to match your pretty button earrings. I've got a matching bow. I think that looks so nice with a purple and grey ear. Scout's gonna be jealous.